When a child is having surgery at Strong in the pediatric surgical suite, the first thing that'll happen on their day of surgery is they will come into the waiting room with their family. And there they'll wait for the nurse to come and get them. When they come into the actual pre-anesthesia area, you'll be assigned a bed, and you'll get hospital pajamas to put on, and you will meet your nurse, who will do vital signs, and that includes blood pressure, temperature, and pulse ox, which measures the amount of oxygen in your blood. It's pretty easy, nothing hurts, very easy. And then you'll meet your doctor, so the surgeon. You'll meet the anesthesiologist, and those are the doctors who help children sleep during their operation. And then you'll meet me, who is the child life specialist. So my job is more to talk to kids about what's going to happen at the hospital and sort of like the flow of the day at the hospital, and also to talk to kids about anesthesia masks. So that is the mask that the kids will use to go to sleep during their operation. Kids who are 11 or 12 and above will have IVs, and that is a tube that goes into a vein in either their hand or inside their arm, and that helps them get medicine that way during their operation to help them sleep. After surgery, they will go into the recovery room, and a parent will, after the child is assessed and is waking up, the parent will be invited to come back into the recovery room to be with their child. When a child is coming to the hospital, no matter what age, there's different things to consider as far as what will affect the child. So if you go onto the Strong website, the Golisano Children's website, you'll find a page that gives fabulous tips on coming to the hospital, things to do ahead of time to prepare children. And it will depend on how old the child is. So younger children, you don't really want to prepare them too far ahead of time because it gives them a little bit too much time to think. When a child is older, you can prepare them a little bit further ahead of time because they're going to want more information. They're going to crave more information. So things that parents can do is use books. They can buy like toy medical kits are fabulous to use with kids. They can use the children's stuffed animals or dolls to practice on, to sort of walk through their day with the stuffed animal. Older kids, you know, they're going to definitely crave more factual information, especially teenagers. And so for those kids, they can use more detailed information. And each library in town should have great books and great ideas for books to use for every developmental level. If people want to have a pre-op tour for their child, they can go onto the Strong website, and there is a spot there that will give them information on how to contact the Child Life Department. And as Child Life Specialists, one of the things we do is bring kids to the hospital, or bring kids through the hospital preoperatively to give them a chance to experience what it looks like in the hospital, who you will meet in the hospital, what you will wear in the hospital. And as you can imagine, for kids, that gives them a real sense of mastery. It helps them have the experience ahead of time in a less threatening environment. And it's a great idea. I very much feel like it's real important for kids to see things and to experience them ahead of time. It's very beneficial. There's child life specialists all over Golisano Children's Hospital that have many different roles. So in the pediatric surgical suite, specifically what my role is to talk to kids about anesthesia. So when kids are younger, they will have a mask. And if you can imagine when the child goes to surgery and the mask sort of comes at them like this, it can be very threatening for kids. So we play with the mask ahead of time. We pick out a chapstick flavor to put in the mask so it smells better. We talk about what the mask is for, and we give the child a chance to, again, to experience that before they're actually in the operating room. Another thing that I do here is when the kids are older, I can work with kids during having IV starts, which is also sort of traumatic for many kids. So we can do relaxation, we can do imagery, we can do some breathing exercises, we can do some distraction for kids who are having IVs or other procedures in the pre-en area. We really strive to create a very child-friendly environment at Strong and at Golisano Children's Hospital. So when you come in, you'll notice that the hallways look friendly. The staff is very child-oriented here. So what I do here is, as part of the whole medical team, is work on the child more than the medical part of it. So I want to make sure that developmentally the child is approached in the best way for them. And then we can also sort of read cues from the child to know that they're more nervous about a certain aspect. Developmentally, for instance, just to give an example, so teenagers are going to be more concerned with how they look afterwards. So what am I going to look silly? Am I going to have to wear a bandage? Am I going to have a tube in my nose, a tube in my arm? Younger children, they're going to be more focused on, when is my parent going to be here? When am I going to be away from my parent? Because that's real important for them. So the child life specialist role can also include assessing the child developmentally to know what their needs are. What I'd like for parents to know is, most of all, when they come to our hospital and they come to the pediatric surgical suite, that they truly are in the hands of medical professionals who have their child's best interest at heart. Everybody here is very focused on children. You might, if a parent were to be in the OR, they might hear the Rubber Ducky song playing in the OR before surgery. You might have the anesthesiologist carrying a baby back rather than putting him in the crib. You'll hear lots of singing here. You'll have a lot of people who really, truly want to make it an experience that's not the same for an adult. The most rewarding part of my job at the pediatric surgical suite is probably knowing that I'm helping kids understand and be less frightened. Many parents will bring their children in and be able to recount experiences from when they had their tonsils out and how scared they were. And knowing that we can facilitate a more nurturing environment for kids here is very rewarding.